Welcome back. This is WION. Well, according to a recent report released by the World Bank, India has been among the slowest in reducing its fertility rate. This even as its population control program predates some of those who have managed the feat in the last few years. Among the list of countries that have managed to do this is India's neighbor, Bangladesh. According to the report, both China and Iran were among the countries that managed to catch up with global averages in under 20 years. India, which started a population control program as early as the 1940s, will still take another 40 years to reduce its total fertility numbers. The TFR, the total fertility rate, as the stat is called, is the total number of children the average woman in a population is likely to have based on the current birth rates throughout her life. The numbers usually range from more than 7 children per woman in developing countries like in Africa to around 1 child per woman in Eastern Europe and other highly developed countries. Well, India's TFR stands right now at 2.43. Bangladesh's stands at a little bit less at 2.34. Well, how did Bangladesh manage this? What are some of the lessons that we can learn? Well, joining me now on this story is an expert from Bangladesh, Dr. Riyad Mahmood, a health specialist for UNICEF, to talk about this topic. Thank you so much for your time and your insights. First of all, what did Bangladesh do to get it right that it's putting itself so far ahead of India specifically when it comes to fertility rates?
Thank you very much for connecting me with the discussion. So in fact, if we see the history of the Bangladesh population program and the dynamics, so in 1975, the total fertility rate was 6.3. And as per the last demographic health survey in 2014, it comes down to 2.3. So these massive reduction in total fertility rate is contributed by different factors. Number one factor is the highest political will of the government of Bangladesh. In fact, in terms of health system, Bangladesh has two big implementation directorate under Minister of Health. And since 1975, to emphasize family planning program, the government had decided to form and establish a different department known as Director General Family Planning to emphasize family planning programs and cut down the fertility reduction. And so that's number one.
Right.
And then the other initiative that was taken in Bangladesh involving the religious leader, I mean the imams, because Bangladesh has around more than 90% Muslim community. So the government also utilized the imams, I mean the religious leaders in Muslim community. So they preach for family planning methods among the general people. That was another innovation, and they were using the verses from Holy Quran to motivate people to take up family planning method.
So sort of using religion, you're saying religion may have played a role in seeing some of these numbers where Bangladesh was able to perhaps control its fertility rates. Let me go back to you real quick. What about India, though? What could India perhaps learn from some of its neighbors, Bangladesh, China, in controlling and improving these results in the years to come?
I think, so for India, India is a huge country with, so different language, different culture. So I think for India, they should have, a state-specific strategy, and they should, develop those strategy considering the context. I mean, the culture, the religion of those states. And in terms of, investment, the government of India really need to prioritize family planning as number one problem, because for Bangladesh, on top of developing a different Director General for family planning and the population was identified as number one problem by government.
Okay.
That helped government to invest a lot. So I think these, two quick things, the government of India can consider. So region or state-specific, strategy and invest for that, and identifying population growth as, one of the top priority in development agenda.
All right. All right. Thank you so much. We appreciate your insights and your input. That is Dr. Riyad Mahmood joining us from Bangladesh from UNICEF.